You are welcome back. I discussed about the causes of hormonal imbalances. I spoke about genetic factors. I spoke about exposure to environmental factors, EDCs, pesticide in plastic things, pesticides, home care products, hair care products, skin care products. I also mentioned some medications and some chemotherapy or radiation treatment that can actually cause hormonal imbalance. I spoke about obesity and weight gain as one of the causes of hormonal imbalance. I spoke about poor diet and nutrition, and I also spoke about stress, chronic stress, as some of the things that causes hormonal imbalance. In this session, I want to focus on some of the symptoms of hormonal imbalance. And when you see the symptoms, when you experience the symptoms, then you can go ahead and do a more extensive test to ascertain if you have an hormonal imbalance in your system. Now, one of the very common ones is irregular menstrual cycle in women. So you realize that your period is not following a particular cycle. You realize that your period is not coming the way it ought to come. Sometimes some women experience bleeding more. Sometimes some women experience lots of bleeding, short cycle, 2 days the period ceases, sometimes the period skip months and doesn't come. All these are parts of the symptoms of hormonal imbalances. And then there is heavy or prolonged menstrual bleeding. There is hot flashes, especially in premenopausal or menopausal women. They experience hot flashes, they have night sweat, they have anxiety, there is mood swings, there is irritability, there is weight gain, unnecessary weight gain. And listen, ladies, as you begin to approach 40, I highly recommend that you get onto the program that helps you lose weight and keep it off. I have that program in our website, Health Solutions Africa. You can go on now, check and get that program. This is going to help you lose weight and keep it off. So, because when once you cross the 35 mark, your body begins to store extra fat and predispose you to having heavy weight or growing very big, and this can be a big problem. So menopause or premenopause is one of those things that bring on this hormonal imbalances. Then we also have fatigue and low energy. There is changes in your libido. You at this time, it is like you don't want to get under the cover again. You do not feel, the need to engage in intimate activities. Then there is insomnia. You find it difficult to fall asleep and to stay asleep. This has easily been fixed when people take anti-aging tea. It helps them to go to sleep because you need an average of 6 to 8 hours sleep every night, and this is important for bodily functions to continue. Please do not starve yourself of sleep except for a very short period of time, and then you get back to sleeping normal 6 to 8 hours every night. You need this for you to function optimally. So the anti-aging tea is going to help fix the sleep problem. So in case you are having insomnia, this is something that you would want to give a try. And then another thing is hair loss. So some women experience hair loss, other women experience hair growth all over the body, the face, the neck, and you just see that hairs are coming out. This is as a result of hormonal imbalance. And then there is acne, and there is other skin problems, and there is digestive issues, bloating, indigestion, gastritis. All these are symptoms of hormonal imbalances. And so what you now need to do is to get a diagnosis. Usually in diagnosing hormonal imbalance, typically it will involve a comprehensive comprehensive medical history. So there will be some kind of physical examination, laboratory test to measure your hormone levels. So treatment will depend on what the result says. And it is very important that you get it done and then start working on whatever hormone is too high or too low in your system. And at this point, I want to say that it's important to work closely with a healthcare provider or an endocrinologist to identify and address hormonal imbalances. I am available if you want to work with me on a more closer setting, a more closer system for me to help you balance your hormones. So this is it about identifying the symptoms of hormonal imbalances. When you are able to identify these symptoms, then it is much more easier to deal with hormonal imbalance. So in the next session, we are going to be talking about the actual treatments, what you need to do to fix hormonal imbalance. Stay with us.